The next person I'd like to introduce, we get a lot of questions about alternative medicine. So we hear a lot from medical oncologists, from surgical oncologists, but one thing that we're constantly asked about is alternative treatments and supportive care when going through stomach cancer. So the next person I'd like to introduce is Dr. Jill Shainhouse. She's a registered naturopathic doctor, and you can read a little bit about her bio and her education just in your booklets. She works at the Insight Naturopathic Center. Her primary focus is helping oncology patients. She works with many oncology teams to support patients during their cancer treatment, and her focus is on holistic care. So please welcome Dr. Shainhouse.
Thank you so much for having me today. Such an amazing group of inspirational and brilliant speakers. So I'm really honored to be here today. Let's see if I can get my slides up here. So as Katie mentioned, I have been in private practice as a naturopathic doctor for the last 17 years in Toronto. I also completed some board certification exams pertaining to naturopathic cancer care. This designation is FABNO, but it's not recognized in Canada, and I'll talk a little bit about that in the next slide. I also started a program at the teaching clinic of the Canadian College of Naturopathic Medicine. In 2007, we started this new program called the Adjunctive Cancer Care Program, which was a specialty stream for interns who wanted to learn more about how to support oncology patients throughout their treatment. And then I started an oncology program for naturopathic interns it was more of an observation program at Sunnybrook Hospital, just to get them more clinical experience. They get clinical experience at the teaching clinic of the CCNM, but not enough. And so I really wanted to bridge that gap and try to pull them into one of the major cancer centers. So that program is actually in the Louise Temerty Breast Center. But we go into other areas of the Odette Cancer Center as well at Sunnybrook. Recently, I became a member of the board of directors for the Oncology Association of Naturopathic Physicians, which is a North American-wide group of naturopaths that have more training and expertise in oncology or cancer care. So what is a naturopath? I realize that most people probably haven't seen a naturopathic doctor. We are separate from the OHIP system here in Ontario. In a nutshell, naturopathic medicine utilizes drugless therapies such as nutrients, supplements. We give individualized dietary advice. We use herbal compounds, and we use acupuncture as well. NDs in Canada are trained at 2 accredited institutions, CCNM, which is in Toronto, and Boucher, which is in Vancouver. And CCNM actually just acquired Boucher, so it's sort of going to be one school, but just 2 locations. The program is a 4-year postgraduate program, and it requires the similar medical prerequisites that medical school would have, but it's not the same type of curriculum. There are very few residencies available for naturopathic medical graduates, so it is a shorter educational journey, and it's different. So there are subsequent board certification examinations that grads have to complete specific to the province that you're in, and not every province is regulated, and not every state is regulated. So there's a little bit of confusion there. Right now in Ontario, we were one of the first provinces to obtain regulation. But Quebec, some of the eastern provinces are not regulated. And so if you're in those provinces, you may be seeing a naturopathic doctor who is regulated in another province. And their prescribing rights may be a bit limited because they're not in the province that they're supposed to be in. It's kind of confusing. The board certification in cancer care, I provided the website here. It's oncamp.org if you want to read a little bit more about it. And the designation that we're not really allowed to use here in Canada is Fellow of the American Board of Naturopathic Oncology. That's because it was started in the US, but now we have quite a few members on the OncAMP from Canada as well as the US. So how might a naturopathic doctor support a patient with gastric cancer? One thing I will say is that NDs provide supportive care, never an alternative to the standard of care. We get a lot of patients coming through our doors that, even though it's all over our websites, the explanation of what it is that we do, but we do have patients who think that they can treat their disease with an alternative treatment measure, and that's really not what we're here for. We're really here to provide supportive care and to integrate and collaborate with the conventional team. All prescriptions and recommendations are tailored to the individual patient with respect to their conventional treatment plan. So whether that's surgery, chemotherapy, radiation, or targeted therapies, and the symptoms that the patient is experiencing as a result. Our goals are really to provide safe and effective integrative cancer care, to avoid herb drug and nutrient drug interactions, to keep patients healthy enough to complete their course of care as prescribed by their oncology team. We review diet and we make recommendations. We answer patients' questions and we try to integrate. We spend a lot of time with our patients. An initial consultation is typically between an hour and a half to 2 hours. We review everything. We get their whole medical file. Now that we have the online access through portals such as MyUHN or MyChart, we can see everything. We can see the clinical notes, we can see the blood work, we can see the pathology, the imaging, everything. And it's great because we really get a very, very good picture of what's going on with the patient. We spend a lot of time going through everything and sometimes answering a lot of questions that pertain to the conventional treatment. We also work on prevention of recurrence or a primary diagnosis in a susceptible or predisposed individual, for example, someone who has a known genetic mutation or a very significant family history. So what do we offer specifically? We do some of our own testing, depending on what's already been done by the patient's conventional team. We will test for nutrient deficiencies and we'll treat accordingly. Again, we tailor diets for patients post-operatively and during treatment based on what they can or can't tolerate, and side effect management. So GI motility issues, dealing with pain, nausea. We use a wide variety of modalities, and what you will see is that different naturopaths might use different modalities, they might use different tools. My clinic is very evidence-based. So myself and my associates, we use things that are rooted in science. And so that leaves us with nutraceuticals, which is sort of a grouping of vitamins, minerals, amino acids, and probiotics. Herbal compounds, which are plant extracts essentially, which can come in powder, liquid, tablet, or tea form. We use acupuncture, and we use IV nutrient therapy. These are things that have evidence behind their use, and that's why we use them. Now, what proportion of patients are using CAM? And this term is the short form for complementary and alternative medicine. This is a big umbrella term that encompasses everything from prayer, meditation, acupuncture, herbal compounds, nutraceuticals. It's a very broad umbrella term. And when you look at these review articles that assess what patients are doing, the estimated percentage of patients in this one review that I just cited here was between 11 and 95% of cancer patients. That's a pretty big range. If you look at the data, the bulk of those studies estimate about a third to a half of all cancer patients are using complementary and alternative medicine. Now, that may be an underestimated number because there are a lot of patients that don't want to tell their team that they're using anything else or doing anything else. I'm sure they wouldn't have an issue telling them about meditation or prayer, but when it comes to other things, sometimes they're fearful that something they really feel is helping, they'll be counseled off of that. So this is sort of a cartoon of what I look like on a regular basis or my patients, because one of the most common complaints is that their conventional healthcare team is just telling them, don't take anything other than what we're recommending for you. The biggest concern, I think, is around safety. The medical teams, the conventional teams, are concerned that something that a patient's taking that's a nutraceutical or an herbal compound or whatever it may be may interact in a negative way and may hinder the efficacy of the conventional treatment. That's a very valid concern. They might be told, we don't know how that's going to interact with your chemo, so let's just see what our treatment does. And when you're done, take whatever you want. That sort of defeats our purpose, because then we're not really doing anything to help manage them through their treatments. So how do we ensure no drug nutraceutical interactions? Well, the first thing we do is we use a program called TRC Natural Medicines. TRC stands for Therapeutic Research Collaboration. This is just the home screen of TRC Natural Medicines. This, unfortunately, isn't something that's available to the general public for use. It's usually accessible through, like an educational institution's library, or if you're faculty somewhere. So that's how I have my access, is through being a faculty member at CCNM. The interaction checker is what we use the most. That allows you to put in any medications. That includes chemotherapeutics. Most targeted therapies are in there, unless they're really new, then they may not be in there. Pre-meds, post-meds, and then you can put in all of your nutraceuticals. Then what happens is you get a listing of potential interactions: mild, moderate, or severe interactions. And then you have to click on each interaction, and it will describe what the interaction is, and then it's referenced. You have to read these things very carefully, because sometimes they're actually not talking about the drug that you've entered, but a related drug. So this is a tool that we use, but it's not sort of the end of the road with how we search for interactions. Let's say there's a new drug that's not on there and we have no clue, then we'll have to really look into the pharmacokinetics. How is that drug metabolized? What's its half-life? What's it doing? Like, what's the function? Does it use a similar pathway in the liver for metabolism? There's a big umbrella enzyme, CYP450, which is a very, it's a complex enzyme that's made up of subenzymes, and we have to ensure that our treatments, our therapies that we're giving, aren't interacting with a similar pathway that a drug uses. And then we look at theoretical concerns. What's a theoretical concern? Something like antioxidant versus pro-oxidant. That's a big one. The literature does suggest that patients who are on systemic regular cytotoxic chemotherapy, so any 5-FU containing regimen, platinum agents, taxanes, or radiotherapy, the literature does suggest that those patients should not be taking concurrent vitamin A, C, E, selenium, green tea extract, alpha lipoic acid, and there's more potential interactions. Those are sort of the big ones that I thought I'd touch on. Some patients are told, oh, sure, you can take a multivitamin, but just don't take any individual antioxidants. And we look at that a little bit more closely. We might look at the multivitamin, because not all are alike, and we might look at the specific doses of the constituents to determine whether it is safe or not. Is it more than what you get from food? Because if it is, then maybe it's not perfectly safe to do with a direct cytotoxic agent. So this doesn't really include, when we're talking about antioxidants, this doesn't mean that you should eat a diet that's brown and gray and beige and white and no vitamins or minerals whatsoever, but really it's with respect to supplementation. So we're just quite cautious with that. So I wanted to touch on a few items with respect to what the literature does support for gastric cancer patients to use concurrently with their treatment. I didn't really have time to touch on absolutely everything, so I thought I'd touch on some of the more important things. The first one I wanted to talk about was omega-3 fatty acids. Omega-3 fatty acids have been extensively studied. These fats are anti-inflammatory fats that reduce inflammatory cytokines, and you can get omega-3s from flax, algae oil, and the dreaded fish oil, which tends to repeat on a lot of our patients. But there are companies that have worked really hard to introduce flavoring agents that make them a little bit more palatable. And any time that we're supplementing with a fat, like an omega-3, we usually start with a very low dose and then work up very slowly. But what the majority of studies have shown is that supplementation with omega-3 during chemo or radiotherapy for gastric cancer leads to weight maintenance or gain and preservation of muscle mass. Muscle wasting or atrophy is a very tricky thing to come back from. And it's sort of a vicious cycle, right? It's hard to eat after after surgery and treatment, and it's hard to move around and use your muscles, and so that leads to muscle wasting. Omega-3s are one of the things that have shown to help prevent that muscle wasting syndrome that happens. And as I mentioned, omegas also reduce inflammatory cytokines, and they also have been shown to help improve function. We also are very careful to prevent the most common nutrient deficiencies that can occur post-gastrectomy. I've listed them here. B12, iron, folate, and vitamin D are the most common nutrient deficiencies that we can see. But how deficient are they? How do we know how much to give? Is it a one-size-fits-all dose? It shouldn't be, because not everybody's the same, and so everybody shouldn't be treated the same. And so we do always recommend testing. These are easy things to test in the blood, and you don't really need to do fancy panels to check these things. Vitamin D test that we typically recommend is a serum 25-hydroxy-D, and we will prescribe accordingly. B12 is just a serum B12, and you can do an RBC folate and a whole iron panel. Like, these are easy things to test. Some patients that come to see us, they really want a full assessment of their nutrient status, and so they'll do something called a nutrient panel, which even some of the regular labs like Life Labs has a nutrient panel, which is a little bit more comprehensive, and looks at a wider range of nutrients. And again, we'll prescribe accordingly. Some patients want to know, how are they digesting? Like, what's coming out at the other end? And that's, we can test that by using something called a CDSA, or a comprehensive digestive stool analysis, which looks at a number of things. It looks at how are things being broken down? Are there inflammatory compounds? It's also a good indicator. Also looks at the microbiome, which I'm going to talk a little bit about now as well. So we've also found that SIBO, which I don't know if many of you have heard about, SIBO stands for small intestinal bacterial overgrowth, is very common in post-gastrectomy patients. This can be tested for, this condition, small intestinal bacterial overgrowth, with a breath test. And when this bacterial overgrowth occurs, we do see more malabsorption. So sometimes we have to figure out exactly what's going on to fix issues like this. There are new tests now available also that map out the microbiome of the GI tract, which are really neat, because you can actually see exactly what microorganisms are in excess and which ones are in deficiency, and you can prescribe probiotics accordingly. So probiotics are, this is sort of an interesting topic in itself, and I could do a whole lecture on this, but I just thought I'd touch on the most important items here. A lot of conventional medical oncologists are not comfortable with patients taking probiotics during their treatment, because they're concerned that with low white blood cell counts, low immune function during treatment, that potentially a probiotic could lead to an infection. This is not really a common thing that we see. In fact, in 17 years, I've never seen that happen. However, I see the issue. I see the potential for something to happen. But I just thought I'd review what the research shows. So here was a randomized trial of probiotics to reduce the severity of physiological and microbial disorders induced by partial gastrectomy for patients with gastric cancer. This is a 2019 publication. And they used a probiotic of this combination that I have listed here. It was a bifidobacterium, lactobacillus, and enterococcus, and a bacillus species. And what they found is it's enhancing the patient's reduced inflammation, and it was actually beneficial to restore the microbial biodiversity of patients who received gastrectomy. So what they found at the end of the day was that oral probiotics may help to prevent physiological and microbial disorders when provided to cancer patients after gastrectomy. And I guess, you know, we could look at whether a patient's receiving active treatment after their surgery or not, and decide whether that's a safe thing. And this was another CT randomized controlled trial using probiotics and fiber in 2017. This was part of an enteral feed, and my understanding from Dr. Ferry's presentation was that this isn't really done that much anymore, the enteral feeding. However, this was significantly helpful in reducing postoperative diarrhea and dumping. If a probiotic supplement isn't allowed, what we'll sometimes say to patients is, well, why don't we look at some of the foods that you could potentially eat? And one of the high probiotic yogurt type foods that we've been trying to implement in patients' diets is kefir. This is a fermented milk beverage. It's like yogurt, but it's a little bit more sour. And it contains a bacteria called Lactobacillus kefiri. And in the States, they're actually studying this at a couple of medical institutions. I believe it's University of Northern Colorado got a grant to study this bacteria and its effect on immunomodulation and working as an anti-inflammatory. And what they're looking at it is they're looking at it for the potential for its ability to help decrease proliferation of GI cancer cells. So it's pretty interesting stuff. And I do like to give a food if I can, as opposed to a supplement. I wanted to touch on acupuncture. Now, sometimes patients have zero interest in acupuncture because it's using needles. And a lot of our patients, I find, are really tired of any needle, whether it's an acupuncture needle, which are very fine and don't induce a lot of pain. They do induce sort of a heavy sensation. If you've never had acupuncture, we're sort of looking for this heavy, dull ache, but it shouldn't be a painful treatment by any means. Acupuncture has been extensively studied. I didn't put a point on the slide here, but I thought I would mention that we do use it in protocols to prevent and treat nausea. And also, we use acupressure if a patient is really averse to having acupuncture or if they need chronic stimulation for the most sort of important point for nausea, which is actually 3 finger breadths from the wrist crease right about here. And there are these acupressure bands that you can get that push on that acupressure point, and you can wear those as needed. And that's actually been studied to be used along with antiemetic drugs to be helpful. But acupuncture using needles has been shown to be significantly helpful in reducing GI symptoms induced by chemotherapy and improving overall quality of life in patients with advanced gastric cancer. This particular study that I cited here, they were using platinum and taxane-based regimens. Really, acupuncture doesn't have a lot of adverse effects. If you have low platelets, you could get a bruise. Some of that can be avoided with technique and using different needles. Acupuncture is also, I would say, our best treatment option for chemotherapy-induced peripheral neuropathy, which is the annoying buzzing, tingling, numbness, nerve damage that happens in the hands and feet, both from platinum agents and taxanes. What this study showed that I cited was reduction of pain and functional limitations. So it's a really good treatment for that. We do use it quite frequently. I suppose the downside to it is that you have to come in pretty much once a week. Usually, I would say most patients require about 4 treatments to determine whether it's going to be helpful for them or not. But it is a really helpful treatment, and I've seen it be, do amazing things clinically. We'll sometimes also add in laser therapy in conjunction with the acupuncture if there's a bit of response from the acupuncture, but not quite enough. And that sometimes is a really effective combination. I wanted to talk a little bit about IV therapy and injections as well. So in depleted patients who are having a really difficult time tolerating their oral diet post-operatively, and all of the patients who are listening today, I've seen this, and sometimes it takes months and sometimes it takes years before they learn what they can and can't tolerate. And we find the following types of infusions and injections to be helpful. We do use nutrient infusions, I'd say closer to post-operative time, where patients are really finding it challenging, their energy levels really low. The upside to doing infusions via or nutrients via an infusion is that you're bypassing the GI tract. So there's no reliance on the GI tract for absorption. You're putting nutrients directly into the circulation. We are limited in Ontario in terms of what we can and can't use, but typically an infusion for a post-gastrectomy patient would include some fluids, some vitamins, some minerals, maybe based on the blood work that they bring us. We always run electrolytes if they haven't already been done to see if we can help with anything in particular. We don't do TPN, so we're not doing total parenteral nutrition, but we can use amino acid combinations, which I find help patients so much with respect to their energy level, especially if they're having a difficult time tolerating protein. We also might consider intramuscular shots of B12. It's just a quick, easy way to get B12 into the body. Again, you're bypassing the gut. We prefer to use methylcobalamin, which is our favorite form of B12 because it helps treat neuropathy. It's a methylated form, so it's safe with respect to DNA replication and just cell cycle regulation. We do prefer oral vitamin D, but we have been starting to give intramuscular shots of vitamin D as well. The reason we prefer oral is that the IM preparation, it is a fat-soluble vitamin, so it's a little bit of an ouchier shot because it's a really thick substance. But we do that if a patient's serum 25-hydroxy D3, which is the vitamin D level, isn't budging with oral supplementation. We also use quite a lot of mistletoe therapy, and this is a therapy that's more commonly used in Europe. It's the two types that we can obtain here in Canada, Iscador and Viscosan, made by a company called Helixor, are manufactured in Germany. Iscador has been around for a little bit longer. Viscosan or Helixor is a little bit easier to obtain here in Canada, and we have a Canadian distributor now, so we use both. Studies are very positive for the use of subcutaneous mistletoe. It has two ways that you can use it. You can use mistletoe, not Iscador, but Viscosan or Helixor. You can use it IV and subcutaneously, but the Iscador you can really only use subcutaneously. What this is an immunomodulatory therapy. It's a gentle immune therapy that works on various aspects of the immune system. It enhances natural killer cell function. It does a number of things. It improves the macrophage capability, the cleanup crew, essentially. The studies show that using this therapy in conjunction with standard chemotherapy, I wouldn't use this with immunotherapies, standard sort of conventional immunotherapies, because we have no idea how the two would interact. And I just could see that not being a good thing. But when we're using this with, I'll just sort of call it our standard primary chemotherapy, this seems to help improve quality of life, helps to sustain blood counts. Patients do better in general. And studies have shown that this is a safe and well-tolerated therapy. It does have the side effect of causing a local red reaction, which is like a mosquito bite. And that's actually a positive sign. That means that we've triggered an immune response, and that's how we determine what dose a patient requires going forward. So this is a very nice adjunctive therapy that we've been using for years, and it's been used for decades upon decades upon decades in Europe. And it's covered by some European governments, which is interesting, as a standard and additional therapy for patients. So how much do naturopathic services cost? I thought I would just give you an idea, because there is no coverage in anywhere in Canada by the provincial health programs. Naturopathic consultations and treatments, though, are covered by most private insurance plans that vary sort of plan to plan what will be covered. And fees are going to vary depending on the length of consultation and the treatment type that you're having. I put a link to my site here just so that you can get an idea of what a private clinic might charge. But what I will say is, if you're in Toronto and you're looking for care and you don't have coverage, or you're just looking for a more affordable way to pay for naturopathic therapies or consultations, the teaching clinic is somewhere that you can get a reduced rate. There is a bit of a process, but there is that option for patients. It's a little bit of a different setup. So if you were to go to the teaching clinic, you're primarily seeing a naturopathic intern who is supervised by a licensed registered naturopath in the province of Ontario. That specific program, the Integrative Cancer Center at the teaching clinic, does have 2 NDs supervising the program that have completed the board certification in oncology as well, just so you're aware of that. I wanted to create a couple of slides on unproven therapies, and also the next thing I'll talk about is cannabis. I just wanted to say that there is a lot of information out there. There's a lot of people that go online that, anecdotally will talk about their stories and what they've done. And then there's just a lot of stuff out there in general. And you have to be really careful with what you read online. And be wary of any alternative diets or treatments with little to no evidence rooted in science that claim to result in cure, right? Nobody that's doing anything that's outside of mainstream medicine should really be claiming that they can cure disease, because that's just, that's just not right. And I know everybody has well-meaning neighbors and friends and family members that are going to bring you all sorts of remedies, but I would just suggest that you always seek out the advice of a licensed professional before you embark on any integrative or additional plan. It's really, really important. And not all naturopaths are alike. So I would urge you, if you're trying to seek someone out, go to that oncamp.org site and just have a look at who has completed extra training. The core curriculum really doesn't provide enough of a sound oncology curriculum, in my opinion, and we're trying to change that. I'm part of a specialization committee, but I really do urge you to see someone who really knows their stuff that can provide you with a very safe plan. That being said, I also wanted to talk a little bit about cannabis. Cannabis products are now legal for use. You can go to any dispensary or store and buy all kinds of things, candies and other edibles and topicals and smokables and vaporizables and all kinds of things. And I will say that cannabis can help patients a lot with their sleep and their appetite, nausea, and pain. Now, naturopaths can't prescribe medical cannabis, but I wanted to talk about it a little bit because I get asked about it a ton. And NDs should be referring to licensed MDs who have it's not that there's extra training, but they've sort of taken it upon themselves to learn more about the prescribing of medical grade marijuana. So there's the recreational stuff, and then there's medical grade cannabis products. It should be done with medical supervision if you're going to take any cannabis products, especially if you're taking it in conjunction with something else that causes sedation. So let's say you're on a sleeping pill and you also had some pain, nausea, or low appetite, and you wanted to see whether cannabis could help with all of those things. You're going to get an additive sedative effect when you combine something that has a considerable amount of THC versus the CBD, which is the less hallucinogenic sedating component. I really do suggest that patients get some medical supervision. What will happen is you would see a physician online virtually, and they would go through your whole medical history and the medications that you're on, and they would basically set you up with a what's called an LP, or a licensed producer. And then you could obtain through that licensed producer medical grade cannabis. And if the first one they recommend for you isn't working, and they also recommend a dosing escalation, then they'll find something maybe that does work better for you. There's so many different types and different ratios of the CBD to THC. So I think it's really, really important to get good counseling on the topic of cannabis as a treatment. Whoops, I just wanted to... Oh, okay. I had another slide, but it's not here. It was just a study supporting the use of cannabis as a safe and effective therapy for treating sleep, appetite, nausea, and pain. So I'm sure there's going to be a lot of other questions about individual therapies. And so hopefully we'll get a chance to answer some of those in the panel discussion. But thanks again for having me today.
Thank you, Dr. Shainhouse. That was a lot of great information, a lot of great advice. And as Katie had mentioned before, we do get so many questions about naturopathic medicine and how to involve it with the normal types of treatments that patients have to deal with. And I'm so happy that Dr. Shainhouse, you mentioned that it is supportive and that you work with the medical team and all of that, because for us that is really, really important. If patients, do want to include naturopathic medicine, we always say, be honest and speak to the entire team so that it is a holistic and a comprehensive treatment that you're looking at. So thank you. And of course, there's a lot of questions, so we will look at those during the panel discussion.